the first instance, the first way to talk about lifestyle changes is incorporating physical activity, right? Because remember, you have to remember some of those food types that some of the foods that you are eating now, our forefathers were able to eat it, but still go to the farm and burn out that fat and burn out some of that food. So the same amount of apple that you are eating, and after eating, you sit down and watch Manchester United and Arsenal for 2 hours, 3 hours, and then you drink, you eat more nkwobi and drink Saint Remy. That amount of apple is the same thing that your forefathers will eat and go to the farm and burn most of them, right? The issue is a sedentary lifestyle, and not necessarily not necessarily that you're eating over, not necessarily the amount of food that you eat, right? Portion control is very important. But if you eat the same amount of food and you work out, it actually is a little more healthier than if you eat that same amount of food and you stay sedentary. Usually, when I advise patients, right, it's hard to go from 0 to 100, especially for people who, work a lot and they don't have time to make their own food. They buy food from the corner store or they buy from Maput. First thing I always tell them is increase your physical activity. Start from there. I'm not saying that you should not avoid the foods, increase physical activity. So you may eat the same amount of foods that you're eating, the same thing that you're eating outside, but increase physical activity. I tell them, the evidence suggests that you should be working out at least 150 minutes a day. A week. You can split that into 150 minutes. Is what is that? 2 hours and 30 minutes. If you split that into 7 days, I don't know how much it's going to be, but around 150 minutes a week. 120 to 150 minutes a week. If you increase physical activity, if the same amount of food that you're eating, probably you have a lesser amount of sugar staying in your body compared to if you are not working out. That's usually first step. It doesn't mean that you should not do other things, but I think for people, it's always good to start very little. So increase physical activity. After you increase physical activity, and I see the patient is doing well with physical activity, they're going to the gym, I now go to the second part. Okay, you see that's the amount of foods that you're eating. Now, how about instead of eating the same amount of portion, maybe you can cut it down a little. Instead of eating 3 big wraps of fufu, why don't you just eat 2? Right? I'm not saying you should not stop eating fufu. Keep eating fufu. Keep doing the exercise that you're doing successfully. But instead of eating 3 wraps, now eat 2 wraps. Right? So little by little, you're making increments. And this may take periods of like months to a year to get that patient to eventually get to that healthier lifestyle. Right? So now you start talking about portion control. Then the next thing I start talking about to them, once they feel that they can now control that portion, is to say, okay, now you see that apple that you're eating, instead of eating that apple, why don't you replace it with what do you call this? The one that you use plantain to make.
It's plantain. I don't know.
Yeah, flour. The one you use, plantain flour, like or plantain flour. I say, okay, now we are talking about substitution. Instead of eating that apple that's high in starch, why don't you use unripe plantain flour or oats? Why don't you use ground oats? So you see how it's very gradual, right? At first, I tell them you can eat some amount of food you're eating, increase physical activity. Then I start talking about, okay, now portion control. Now talk about substitution. So if you're eating fried meat all the time, I'm like, okay, you can eat as much meat as you want. Maybe next time the thing that you can work on is instead of eating fried meat, why don't you eat baked meat? Or after cooking your meat, instead of eating the same day, let it settle, let all that fat come to the top on the broth. Take that out. When you're eating your meat, why don't you take off the skin? Because the skin has a lot of fat. So it's all little by little, step by step. You eventually get people there. But if you start off from day one, stop eating this, exercise, do this and that, people get overwhelmed and they give up easily.